Hi, Michael. I was one of the 800 at the Sicko premiere on Saturday of Bel Air, and I'm taping this message for you about two things. One, how women are treated in the healthcare industry, and two, how cancer patients are treated. In 1997, after 7 doctors and a few of them who told me that I was sick in the head or that I had nothing going on with me, I was finally diagnosed with fibromyalgia. Since then, I haven't been treated effectively for it because the medical profession is still trying to guess whether or not the malady exists. 2003 comes along, and right before my wedding, I started to experience symptoms of a heart attack minus the injury to the heart. In 2004, I was diagnosed with an anomalous origin of the right coronary artery, meaning that my right coronary artery was in the wrong place since birth. In 2004, in February, I had bypass surgery. A year later, after I'd been in cardiac rehab, I found out that I had breast cancer. In May of 2005, I had a double mastectomy, followed by 4 months of chemotherapy, a recommendation for radiation, which I didn't accept, and then a year and a half on an oral agent that was ineffective to treat cancer. Michael, women in the healthcare industry are treated as if they are hysterical, as if they are hypochondriacs, and as if nothing is wrong with them except it's created in their head. Case in point, in 2003, when I explained to the first doctor, there were 3 doctors in 2003 before I found out in 2004 I had an anomalous origin in the right coronary artery. The first doctor I saw told me that my problem was due to the fact that I had big breasts and that what I needed to do was pump them up, do some more upper body exercise. That type of exercise would have killed me back then had I followed it. In terms of how cancer patients are treated in the industry, it's almost as if the expectation is that you're going to die. Having had bypass surgery before I had a double mastectomy a year later, when you come out of heart surgery, everybody's jumping all over you, doing everything they can to make you comfortable, to make sure that you're upbeat, to make sure you're recovering. When you have a double mastectomy, you come out of recovery to a room by yourself. And you're lucky if when you press the button, if a nurse will come. I don't know how many of the people out there know that a double mastectomy, if you don't have reconstructive surgery with it, meaning they put expanders underneath your chest wall to make it rise up so that they can create fake boobs. Most women who just have either a mastectomy where they cut off 1 breast or a double mastectomy where they cut off 2 breasts, if you don't have reconstructive surgery, they send you home the same day they cut them off. That's wrong. But back to the cancer patients, not only is there an expectation that they're going to die or they're treated as if they're walking dead, they become experimental guinea pigs for the rest of the time that they're cancer patients. Case in point, I was given a drug recently, tamoxifen, which I'm sure a number of breast cancer patients are on, but because of my age, 43, there's no conclusive studies to say that tamoxifen works for someone with my age or what my stage diagnosis, which is stage 2. I only mention this because cancer patients seem to also run into a revolving door of healthcare, where when you first get involved in it, it's your surgeon, who then tells you you're going to need an oncologist, who then tells you need to do a genetic test to determine if you have the breast cancer gene, who then, after you finish chemotherapy and you think you're done, tells you you're going to need now a radiation oncologist. And guess what? If you're my age, you might even need a reproductive oncologist. It's doctor appointment over doctor appointment, doctor upon doctor. In terms of the doctor appointments, you'll have chemotherapy. They won't give you the Neulasta shot to boost your immune system. You have to come in for a separate visit for that. And then once you come in for that separate visit, before you can have chemotherapy again in 2 weeks, if that's what your schedule is, you have to see a doctor, whether you feel well or not. All I'm saying is that being a cancer patient is a racket, and being a woman in the healthcare system, I don't know how women get effectively treated. I really don't. That's all.